Well, it's my pleasure to introduce to all of you Professor Heidi Larson, who previously headed the Global Immunization Communication at UNICEF and also chaired the Gavi's Advocacy Task Force and served on the WHO SAGE Working Group on Vaccine Hesitancy. Professor Heidi Larson is the director of the Vaccine Confidence Project, which has a European hub at our university here in Antwerp. And she's professor of anthropology, risk and decision science at the London School of Hygiene and Tropical Medicine. She also teaches at the University of Washington, Seattle, and is a visiting professor at the University of Leuven and Antwerp in Belgium. Her research focus is on managing risk and rumors, and she's particularly focused on public cooperation during emergencies, disease outbreaks, natural disasters, terrorism and conflict. And I'm also happy to tell you that BBC named her as one of the 100 most influential women in the world. So I'm so happy to have Heidi with us today. And Heidi, the floor is yours. Thank you.
Thanks. Here, let me just share my screen.
Sure.
Unfortunately, the influence has not helped the situation in the world when it comes to vaccine confidence. But anyway, I do my best. Here, can you see the screen?
Yes, we do see the screen. Thank you.
Great.
But it's not in presentation mode yet. Yes, yeah, now it is.
Yes, okay.
It is okay.
Okay. Well, thanks, everyone. I'm happy to be here and happy to see everyone here. Most of the presentation today is going to be about the 2022 EU Vaccine Confidence Study, which compared 2022 to previous years because we had the pre and post COVID. We also looked at that impact. But I'm going to step back a few years to give you some context. So we have the background before we move into the COVID impact. So in 2010, I founded the Vaccine Confidence Project because in my role at UNICEF working globally, we saw growing episodes and concerns related to vaccine questioning, vaccine outright refusal by individuals, some communities, and even some government officials, particularly when it came to introducing new vaccines. So it seemed like it was important to start monitoring the situation, seeing where it was getting worse, if it was getting better, what they were doing supportively, what was going wrong in the other areas. And we started this initiative modeled after what was at the time a number of initiatives that were using online news media monitoring to detect early signals of disease outbreaks. So I worked with some of the groups who were doing that early detection to get disease outbreak signals, to basically change some of the search terms to look for emergence of rumors or misinformation to get us early signals of when there might be a problem. We did that, and this was really before social media had become so ubiquitous. So we thought online news media monitoring was more globally accessible if we wanted the global picture. We did a lot of monitoring over a few years, but this is the first paper we did, which was 1 year analysis, and we did a lot of basically human moderating, reading, and coding, and found that the darkest areas were the most skeptical. And already in our online news media monitoring, we, and that included some of the comments on news media, that Europe was pretty close to parts of Africa in terms of its skepticism, not everywhere, but in certain areas. But the one thing we realized that that news or online media, and this is relevant to social media monitoring, is that you don't know who's on the other end. So you don't have representative samples. So while we continue to do the online monitoring and increasingly social media monitoring, which gives you much more real-time signals, we started doing, we developed a vaccine confidence index, which is nationally representative samples. We have a lot of demographic data behind that, behind the vaccine confidence index, which we launched in 2015, age, gender, income, education, all the usual. And then these days with surveys, we also have their GPS location because it's all tablet based, the interviews. So we had a much better sense of where the issues were subnationally. So actually with the nationally representative samples, we similarly found some, particularly, again, not everywhere, but particularly in Eastern Europe and in France, particularly strong skepticism. France had 41% disagreed with the statement vaccines are safe. And it was different in different parts of the world. And we, after this, in collaboration with the European Commission, have done every 2 years vaccine confidence monitoring and increasingly asking specific questions, not only about vaccines in general, but MMR, HPV, and flu, and then also including in the last couple of years, healthcare professionals as a separate cohort. What was going on in these years? Well, this was 2013, this was 2016. And then when we started to dig deeper in terms of what were some of the issues, we started to see it was also coming up in the news. This was a different report from the World Health Organization, looking at how some countries were either plateauing or dropping. There were different reasons. Some of it was the hangover from the 1998 autism scares. This was certainly the case in Italy because there was a court case that actually a parent who was claiming that vaccines caused autism, she won her case, which gave a lot of, later it was retracted, but so there was a hangover, but this then became more of an issue in 2018 with the massive outbreaks of measles vaccination. WHO in general has seen globally that in the last decade, uptake and of vaccines, childhood vaccines in general has plateaued, and a number of countries has actually dropped or backslided. This was between this figure here is between 2010 or even before, it looks like even 2010 to 2018, and the numbers were much higher in 2010, and you can see in Europe, particularly Montenegro, Bosnia Herzegovina, and North Macedonia had dropped, but we didn't have the background rates. And again, this is uptake. This is not confidence, which is what I'm going to be speaking more about. But the reason we wanted to focus on confidence in our monitoring is because we saw it as a predictor. A drop in confidence doesn't necessarily mean there will be a drop in uptake, but it's a signal that you need to build confidence, and it could prevent it. So it was one effort to try to anticipate rather than doing crisis management because your figures are dropping. That's the way. So in 2020, because between 2015 and 2020, we were doing a lot of vaccine confidence monitoring with our confidence index. As I mentioned earlier, we collaborated with the EU to do it every 2 years, with WHO in certain regions, with UNICEF and other regions, with Africa CDC. They wanted us to collaborate with them in Africa monitoring. So there was quite a bit of traction coming up with the index, trying to get a handle on it. Now, what was interesting is between 2015, where you saw that first map, with France quite strong, Europe is quite dark in terms of low low confidence in vaccine safety. And you can see in 2018, Europe is lightening up, which means confidence was building. And that was also because there have been efforts across the EU to build confidence, to increase vaccine acceptance. And actually, our confidence index was showing that actually things are starting to get better, which is a good thing, of course. Our concerning bit was that in Africa, which was more in the blue range, which, as you can see, are more positive end, they started to get more hesitant in Africa. And that was particularly in the Francophone speaking areas. So we are seeing with language diasporas, people reading an online news, going global in certain language, in many languages. If you're anywhere in the world and you're French speaking, you go to French media, or if you're Polish speaking or whatever, you look for your own language news. So the influence of some of the perceptions and concerns spread wildly. So these are the kinds of trends we're picking up, which is helpful for knowing where we have to build confidence. So the other side of the vaccine confidence work that we've been recognizing is that with all this of online, not just internet, which Google opened its doors in 1998, which coincided with the year that Wakefield published his Lancet paper suggesting that vaccines connected with autism. So he got a free stage that he wouldn't have had 10 years earlier, or even 5 years earlier. But in the meanwhile, social media platforms have opened. And I think people forget that, you know, Facebook, Twitter, some of these others only opened their doors in 2006, 2007, 2008. It's not that long ago, but it's had a massive impact in just letting the gates open with all kinds of perceptions, views, unmediated, unmoderated. And it's also meant that people's sentiments about vaccines are much more volatile and much less stable than they were before. So because of all the background data we've also, as I mentioned, been trying to look at what's the impact since COVID. And this was we had done our 2020 study for the EU in March to April, was the data collection, and this was planned before COVID was announced as a pandemic. So we actually had a baseline, and then again, we ran it in March, April 2022. And unfortunately, we've seen a negative knock-on effect on general vaccine confidence. There's been quite a drop in perceived importance for children, and this is across the 27 EU countries. This is the average. A drop in safety, drop in effectiveness, perceived effectiveness, and a little bit of a drop in compatibility with religious beliefs, but not as significant. Again, this was average, and the ones that really brought those numbers down were Slovakia, Slovenia, Lithuania, Latvia, and Bulgaria. The US, this wasn't just an EU phenomena. We have seen it across the EU. This is a New England Journal paper, did with some colleagues in the US, and this is doing very micro level vaccine hesitancy measuring, and you can see the amount of red, which is dark red is over 0.3. So which is the more hesitant region, but it's ubiquitous, and that's quite a change in terms of volatility. They're previously, and globally speaking, much more defined groups because of beliefs, naturopathy, homeopathy, or religious beliefs, or just anxieties that were clustered more. And we've seen the trend that it's really become much more ubiquitous. This was another study that didn't show a dramatic change, but did start seeing drops in the end there, and that was really 2022. This was only during COVID. There was concerns, but then towards 2022, we're continuing to monitor, because there was a lot of fatigue, frustration, even anger about the whole vaccine rollout in some settings. I mean, globally, frankly, we've done pretty well in terms of there's 10, 12 billion people vaccinated. I mean, when you count every time they've had to vaccinate per person, but there was still quite a bit of fatigue and in some places anger. This was another study that was in June 2022, and you can see it's highly varied. I mean, one thing that always strikes me is there are no two countries that are the same. They're all very, very different. This was in Africa. There too, in the work we're doing with Africa CDC, there were also drops in perceived importance, effectiveness of COVID vaccine, which I understand the drop a bit in the perceived change in perceived importance of COVID as the pandemic seemed to be waning. But when you see it, the drop in vaccines in general, that's another concerning story. But when you break this down to countries, this is in Africa, and I'm going to show you in the EU. It's very highly varied, and there are some countries that had particular drops, and Côte d'Ivoire was an outlier in terms of positive uptake. And what was a kind of a moral of the story, as one could say, or a lesson from Côte d'Ivoire, is they built trust. The population was happy with the way they did the COVID vaccine rollout. It was not only a boost in confidence in the system, but they reported a boost in confidence in their routine vaccines. So for countries where people trusted the government, felt they were doing a good job with the COVID vaccine rollout, it could boost confidence. But in a number of countries, it didn't, because people were not happy with the way the whole COVID response was. I'll go, so the headlines before I go into more details on this. Overall confidence has declined since 2020, going back to more the 2018 levels. Fortunately, among healthcare professionals, it remains pretty high. One of the biggest concerns we saw is that there's a growing gap in confidence with the over 65s, either staying the same confidence as pre-COVID or having a boost, but under 34, there's really a significant drop among a lot of younger groups. This is by country. The different lines are importance, safety, effectiveness, and compatibility with beliefs. As you can see, it's highly varied across the region. Sweden, for instance, maintained a reasonable amount of trust with the government, stayed stable, whereas you see with Netherlands, Croatia, Hungary, Slovakia, there were places that and what was frustrating to see is that a number of these countries, like Bulgaria, the confidence was going up between 18 and 20, and then COVID took a hit and brought it down. Also in France, you can see it started to go up between 18 and 20, and then had a hit during COVID. And that's general vaccine confidence, not COVID specific. And then we broke it down to try to make sure that it wasn't kind of a COVID vaccine. People were thinking about the COVID vaccine. We specifically asked about MMR vaccine. And here too, we did see a drop in confidence. And that was quite concerning, because that's really a different issue. But that was more so with the younger generation, or younger age groups, I should say. And the concerning bit about that is that's the new cohort of parents. What was interesting was flu vaccine, influenza. The COVID context was a boost to positive confidence in flu vaccine. Already in 2020, in our study in 2020, we happened to be doing our survey when COVID was announced as a pandemic, and we saw a boost between 2018 and 2020 already with enthusiasm for the flu vaccine, which I think people felt like respiratory vaccine, I'll get what I can. And also there was a lot of talk about the risk of the twindemics, having both COVID and flu. HPV vaccine, we also saw a drop in perceived agreement that HPV vaccine is important, decreased in 17 countries between 2020 and 22, and didn't increase anywhere. It's another concern. So we have a huge, not only responsibility, but opportunity before this. I mean, one thing we see when confidence changes, it can really get more resilient if you don't get in there early and rebuild confidence before people become hardened in their views. So an HPV focus and a youth focus, I would highly encourage. As I mentioned, the age gap is widening. Here we say over 45, but even older. There's a boost or stable or increased confidence, but the 18 to 24 and even 34-year-olds really had a drop. If we look at the MMR, vaccine is important. If you look, for instance, at the Netherlands in 2018, Netherlands in the far right, in 2018, the confidence in the MMR vaccine was pretty similar between the 18 to 34 and the over 65. But already in 2020, with a COVID announced, and 2022, even more of a drop, the gap between the 65 plus, where confidence remained pretty stable, it's really the younger ages, and you can see in a number of countries, Luxembourg, Malta, Estonia, Croatia, even Belgium and Bulgaria, the pink line, the younger group, really has dropped, while the older groups have either stayed stable or even boosted a bit. With flu vaccine, that gap was less, but still a gap, still more of a gap than in 2018. And this is really an important phenomenon. And we've been in discussions with other colleagues in other regions, and this is not unique to Europe. In terms of healthcare professionals, that's been pretty stable. We do have a couple, for instance, in France, there was a drop in safety perceptions, but overall, the general vaccine confidence among healthcare professionals remained pretty stable and strong, which is really important. Although we did have in Austria, Greece, and Ireland, when it came to the specific question about MMR, the largest falls of agreement were in those countries, and that's not a small drop. So this is the kind of mapping that is important to call out where we need to focus, where we need to get more understanding of what also is the drivers of some of these issues. With influenza vaccine, fewer than 90% agree that flu vaccine, seasonal flu, not pandemic flu, is important in Slovakia, Hungary, and Austria. But in general, it was reasonably stable. But those were the three countries that had the most drop. Likelihood of recommending the vaccine, over 90% would be likely to recommend the seasonal flu vaccine and COVID-19 vaccine. So that's good news. And then we have another issue in a number of the reports we've gotten of I just did a paper with some colleagues called Unspoken. And it was about, even though thankfully, you know, in this representative sample anyway, healthcare professionals' confidence was stable. In some of our research, healthcare professionals have said they are not talking to peers and colleagues about their views about vaccines. They're concerned, they don't want to deal with any aggression or different views. And in a way, they, you know, we need them to be talking to each other as peers for peer support. And then some feeling just exacerbated by the aggression and the questioning. It's to scientists, but also healthcare professionals. So that's something that I think needs a different effort and ways to support healthcare professionals and scientists, because this is it's not helpful to say the least. The other thing we've seen, and this is one of the more interesting studies that I've seen, interesting in the sense of it takes a different approach than I think we've all seen a lot of studies on. If you were offered a COVID vaccine, would you take it? We had an epidemic of COVID vaccine willingness studies. But these colleagues in France from INSERM, Jeremy Ward and colleagues, asked after vaccination, were you relieved you were vaccinated? How did you feel? Did you regret it? Did you resent it? And were you angry? And what was really concerning is the amount of anger after having the COVID vaccine really went up as the pandemic went on. And one of the points in their paper is that just because people took a COVID vaccine at some point doesn't mean they're less hesitant. They took it because they wanted to go to that cafe, they wanted to go to that concert or be somewhere with friends, but they resented, and they would say, you know, you're not going to see me near the clinic again when it comes to vaccines. I just did this because I wanted to go to that football match or whatever. As I said, it did not reduce hesitancy itself as a phenomena. It was a very short-term thing with longer-term impacts. Just the last few thoughts here. We do have an opportunity. I think COVID vaccine messages, I would say vaccine messages in general, not just COVID, is we need to put them in the context of COVID recovery. We've lost quite a bit of traction with routine vaccines. Some of it, of course, has been just access issues. But there is also this younger adult concerning drop in confidence and not just access. Sorry, we've been fading a bit on the COVID vaccine, but I think we shouldn't. It's not off the charts yet. We still have people dying from COVID, particularly people who are vulnerable. And we need to understand what the plan is there. But I think overall, not just COVID strategies, but vaccine strategies more broadly. And as I said, the tailored strategies for confidence in young people. And this is our vaccineconfidence.org website, but also you can go there through the University of Antwerp website. Thank you.
Thank you very much, Heidi. On behalf of the VACCELERATE community, I would say. I'm looking at the chat, and we start to have a number of questions coming in. So that's great. I just want to start with a first question. When you were referring to, I would say, the more historical part, 2013, 2015, you were referring, of course, to these autism, MMR case in a number of countries. But do you think it was also due the growing skepticism and hesitancy? Was it due to the fact that we were at that moment faced with introduction of new vaccines as well? Or was there a trend that in general in the society there was a growing skepticism that continues up to today, and that we see many more parts of, I would say, of society, and in many more discussions like on climate, like on energy and so on. So just to listen to your view on that.
Well, I think that it certainly wasn't only because of the suggestion of MMR and autism. I mean, before that, this in some countries, people looked at the risks of thimerosal in vaccines, and there was a lot of anxiety about metals in general, or anything there, and there have been different issues. There was also the beginning of rollout of HPV vaccine, which was approved by the FDA, and I believe it was 2006. And already in a number of countries that started to roll out with a very bumpy road and still not totally stable. Yeah, I think absolutely. Additionally, other vaccines, but I think we can't overstate. And I think we're seeing it now, the impact of this new communication environment, which has basically flattened communication to be totally horizontal, totally unmediated, and really provoking a lot of really aggressive negativity. And I think with COVID, it just threw the gates wide open. I think many people that typically weren't even looking for vaccine information online started looking. And I mean, I had a number of people say they had no idea before COVID of all the critical things on vaccines online. And it started to make a lot of people question. A lot of it was absolute misinformation, but they've been exposed to it. So I think we have a lot of work to do. Just this past week, I know in the US, there's a new massive trust initiative, trust building and initiative. All the professional organizations across the US, the scientific, NIH, all of those groups came together to say we need not only a reactive, but a strongly proactive measure, that it's seriously undermining confidence, and that so I'm going to find out more what they plan, because it's a very large list of organizations, and where they're going to start is another question. But anyway, I think it acknowledges the fact that we've got challenges now. But I think, part of what we need to do is, there is a lot of attention to how the damaging effect of that, but I think that we can't let that drown out our positive efforts, because it was pretty amazing how many people we got vaccinated in the world. And frankly, it was pretty amazing there were as few side effects as there were in terms of serious side effects. When you vaccinate over 10 billion people with a brand new vaccines, one could have, it was, we could have had more problems than we did. And actually it was pretty amazing. So, and in with other vaccines, we have to remind people, but history doesn't work so well with current audiences when you say, but it saved lives, but people say, well, then there was a bigger problem then.
Okay, thank you. I have another question here, whether you could investigate which type of healthcare professionals play the largest role in influencing vaccination behaviors, which was not evaluated in the earlier report in 2018. A certain group of healthcare workers that might have a larger impact on vaccines?
Well, we do know that in general, nurses are a bit more skeptical than doctors. I mean, when we disaggregate the healthcare professionals, and particularly even more so midwives. But in terms of particular group, I think it really depends. It really depends on individuals when it comes to healthcare professionals, or when you get groups of healthcare professionals that come together. And I mean, I know there's some, and Pierre, were involved in some efforts in the area of new innovations in supporting healthcare professionals, but also, you know, how can we find ways to answer some of the questions that are coming from the public without putting additional stress on healthcare professionals that are already overstressed in terms of time, in terms of burden of work. And I think we need another layer in there. And I often talk about putting somebody in waiting rooms that is there just, or a couple people, depending on the size of the clinic or whatever, that is just there to help answer questions, hear your concerns, answer any questions. And people that are medium, that you don't need to be a GP or a specialist or even a nurse, that can help people think through and navigate their questions. We're doing a lot of work with chatbots to help answer questions. So there are things we can do to try to deal with the tsunami of questions from the public, I think, without putting the full burden, which it is on now, the frontline workers and vaccinators.
Sure. Now, the audience, of course, is working within the EU VACCELERATE project, so trying to improve and speed the implementation of large immunization trials in Europe. What you showed is not helping, I would say, recruitment probably for vaccine trials. If there is a general lack of confidence, this might have also an impact on the recruitment efforts for our trials. But I see that also Zoe from Cyprus is making the link with vaccine trials. Although, Zoe, I must say that Cyprus data were very positive in the analysis of 2022. So Cyprus is doing very well. But I invite you perhaps also to ask your question about the mapping of the perceived importance of the public. So please feel free to do so.
Thank you very much, Pierre. And first of all, I would like to congratulate and thank Heidi. It's an honor to have you with us today. And also Stefano from the European Pediatric Society. So it's nice to have, let's say, groups also from other consortia. So my question or comment is related, as Pierre said, with an observation during the COVID-19 pandemic, Heidi, that actually the public, but also specific groups, underserved groups, minority groups, have a huge misperception related with vaccine clinical studies and trials. This is not directly, or possibly not directly related with vaccination confidence, but we would like to hear your expertise, or if there is any initiative related with that, because what we saw also, and this is concerning as faculty members, because most of us, we are academic people, we saw also students, I mean, future healthcare professionals to be very concerned about participation, about what it is really, and what is the importance and the added value of vaccine clinical studies. So we would like your input on that, because it's also related with our priorities in the VACCELERATE consortium. Thank you.
We have, as a group, the Vaccine Confidence Project, in the last particularly 8 years, have been doing more and more with trials, and partly because we think the more upstream we can go with confidence building, the better. I think actually, in a way, trials are an incredible and an important opportunity to involve people. And the more, but you need budgets for this. And I have to say, to the credit of the EU, and Pierre and I had worked together on some of the Ebola vaccine trials in Africa, they put a separate budget for communications engagement, compliance, acceptance, and around trials, because you need people. And that's, I think, in trial studies, the more you can put in budget for support, think of it as an insurance plan. We've had remarkable success in areas that had never seen a trial before, because there was a lot of engagement from early on. People were involved, and particularly when it's a trial, yes, it's, new and not tested yet. On the other hand, when people feel involved from the beginning, they'll have less questions later. So I think that, and if you really involve them, and there are ways to involve people, as listeners, as community support groups, as we've had some really eye-opening, beyond what I would have expected. And people have, even in Africa, but also in some of the other settings we've been working in, people have more common sense than some. Right now we feel like nobody has common sense, but actually, there are assets in communities that you can build on. You just need to find the people who are on board and eager, and they can be real value. But I'm happy to help with people when they're thinking about, okay, if we need to put in a budget, we've done a lot of them. What do you put, what are the items you put in there that you need to support you? Because we can't expect the clinicians, the trialists themselves, to be managing communities and doing all the work, which is a lot, to make a trial a success.
It's a bit what you were writing, Zoe, also in your question at the end. The more we make clear to people what efforts we do to show that the vaccine is safe and that it is efficacious through these participation in large trials, the more people will be convinced that we are really investing in their health, and that it's not just a quick approval process, but that there is a lot behind it. And I think I recognize what you're writing here, and also what Heidi is answering. This might flip over in a positive way. Having a good communication about participating in trials might have an impact on later participation in immunization programs. So this is something we really need to take home as an important message. I see also a question from, I think what Michael Niemann is writing, exclusion of pregnant women from vaccine trials. We know this is, of course, very often because of ethical reasons, and of course, because of GCP. But on the other hand, it might give the message to pregnant women that they should not be vaccinated with that vaccine, although very soon with COVID-19, with influenza, we have seen that there is a need for an indication for that very specific group. So the perception of excluding people in participating in clinical trials might also have later on a very negative message towards the participation in immunization programs once the vaccine has been approved. And I think that's the point that Michael wants to make. Is it correct, Michael, if you want to join?
Thanks for this presentation. Very nice. So the notion that exclusion of pregnant women from clinical trial is the ethical thing to do actually means that pregnant women are vaccinated off-label in the absence of clinical trial data, which is an unethical approach for vaccination, and it reduces the confidence of both the pregnant women and their physicians and their family. So I think it's really, really important to work on ethical guidelines in order to allow pregnant women to participate in clinical trials, particularly when the vaccination is critically needed in order to defend them and the baby.
Sure, thank you.
Yes, I mean, we did a 15-country study with GSK in terms of pregnant women's willingness to accept vaccines because anticipating RSV, but also other vaccines in general. But within that, we were also asking about willingness to participate in vaccine trials. And actually, aside from a couple of European countries, in that 15-country study, there was a lot of openness. It was, and I think, as you say, right now, the only data we've had is more observational. When people accidentally get pregnant during a trial, but I do think there's a change in the environment because there has been a good bit of agitation to say, listen, we need to understand. So I think the winds are changing, as they say, or tides, or whatever the saying is, to include pregnant women more. Obviously, it's going to need a bit, considerable rigor and caution, and they're not going to be the first group to be in the trial. So I think it's a time to, another thing to think about in your trial protocol.
Thank you very much.
And Oliver Corneli is with us, and you want to raise your point, which is linked to what Michelle just said. Yes, hey, Oliver.
Yes, thank you. And thank you, Heidi, for your excellent talk. I missed the first minutes because everybody here is down with Corona. All the attendings, 50% of the attendings have contracted.
Not over.
Yeah. They are not allowed to enter the hospital. Yes, I wanted to extend the point that I very well understand that Michelle made, and from the pregnant, adults, now to what about the children? And what, I mean, we just don't agree on the definition of children, but let's say below 18. And I'm not a pediatrician, but a father. So, so I would actually be open to children in clinical trials. And what, do you see that? I mean, because children are always being only offered clinical trial participation later, right? Same thing as with, or very similar to the to pregnancy.
Well, I mean, in the trials that I've been involved with, as you say, I mean, you start with the healthy adults, and you move down further and further into pediatric, and then pregnant. That's an option. I don't know. I mean, personally, I probably think that's probably a good strategy. Rather, I wouldn't start with kids. I mean, infants in particular, but you're right. I mean, what is an adult? I know I worked in UNICEF and in the UN for several years. So according to the Convention on the Rights of the Child, it's up to 18. But, we know that the difference between a 6 and a 16 and a 6 months, 6 years, 16, whatever,
Sure.
it's very different. So
some are 19 and are too young.
Yeah, exactly. Exactly. I hope it's not your son or daughter, but
I must say that in comparison with most of the drug trials, for vaccine trials, we rather quickly move to younger age groups. And of course, that's very often because of pediatric vaccines with a very pediatric indication. So that's already one advantage compared to very often the drug trials. But it's an important point you raised there, Oliver, to pay attention for that and to extend rather quickly to the target group of the pediatric population. Absolutely. I see also from Stefano, and indeed, so I think that's a very good point, and I don't want whether you want to make it live your point, but in the EU projects of EU Coalition of Vaccination and Immunion, we have the active participation of students like the European Medical Society of a student association, and the nursing students and the pharmacy students, which is important for the future. Yeah, hello, Stefano. So if you want to make your point, please feel free to do so.
Just basically to mention that all the European students associations, so nurses, doctors, pharmacists, and also dental students are involved in the EU coalition of vaccination, and their request for more training on vaccination has been a sort of a common message at every meeting. Regarding the trials with the children, just let's remind that I agree obviously with Zoe, but let's also remember that parents decide. So it's obviously you are facing an adult decision for a child. So it makes there is always this person between the child and parents' fears. Being a father and a grandfather, I fully understand also parents' fears and their attitudes, because we all know that decisions regarding vaccinations in children is mediated by the parents. And last but not least is, depending on the healthcare provider that the family has, they might have different ideas, because we showed in our survey that families whose children were cared for by, let's say, alternative medicine type of professionals obviously had the least trust in vaccinations and were much less confident than families who had a pediatrician or a GP.
Sure, thank you. To come back to your presentation, Heidi, you were mentioning that age gap that was very clear in the 2022 data. Has this to do with different lines of communication in different age groups, or do you see other potential reasons for this kind of age gap that we see in an increasing number of countries, in fact?
Oh, I think it's very much a COVID effect. I mean, young people around the world, and we have another initiative that here you're aware of, the Global Listening Project. We're trying to capture people's experiences around the world to inform better societal preparedness for pandemics. And in that broader research beyond vaccines, we are seeing a lot of anger, frustration among young people about the whole COVID experience. They resent the fact that they had to, quote, pay the price for what was more of an older person's problem. And they feel like they've lost years of school. They had to take vaccines and they weren't the biggest, it was for somebody else. And there's a lot of 2 years of pent up frustration and feeling like, they were forced to do something they didn't want to do. They were held in from their social life, their school, and maybe this will, I don't think we should hope that it gets better with time. I think we need to be there and try to change their, sense of the importance of vaccines before they harden in that view, rather than waiting to see if it was just the COVID effect. But I think it's very much their frustration with the last couple of years, and they're taking it out on vaccination, which we've seen over the years that vaccines are a real platform for people to express their grievances because it's for everybody.
Okay, thank you. I'm looking at the chat box again, but I don't see more questions for the moment, unless someone wants to raise his or her hand and ask a question, not through the chat box, but live, which is also possible, I understood from the organizers. And then please feel free to do so. No, I think we are almost done. We have 3 more minutes. If we have no more questions, I don't know whether you have a message for us, Heidi.
Just one, please put engagement, communications, trust building in your trials, and we're on call to help with that. I do think it would be really important to think about ways to involve younger people and pregnant women, of course. It's not obvious, but I'll tell you, in our routine monitoring in Eastern Europe, we see particular anxiety among healthcare professionals about recommending vaccination to pregnant women. There's a particularly high resistance to that in a few of the Eastern European countries. So I wouldn't start there with trials with pregnant women, but I think the more we can get trials going with these underrepresented groups in areas that are more positive, to give the example of them, the better. And that's where this confidence mapping can be quite helpful, because start where there's more positivism and then in the meanwhile build the ground elsewhere. Anyway, we're on call and great work. I'm really glad you have this initiative.
Okay, thank you very much on behalf of the VACCELERATE community. And I think what you said is a very important message towards our future plans. So many thanks, Heidi. And back to Janina.
Yeah, thank you so much, Heidi. This was really a brilliant, very interesting talk. And I think a lot of very interesting things that also we can learn from for our future work. So thank you very much. I think everybody enjoyed it, because I don't think we've ever had so many questions after a talk. Well done. Thanks a lot. And yeah, hope to see you here again.
All right. Thanks.